We're going to beef up our existing laboratories and establish new ones across every region for testing. We will establish 3 infectious disease control centers for each of the zones of our country, that is the coastal, middle belt, and northern, with the overall objective of setting up a Ghana Center for Disease Control. The recent tragic CSM outbreak, with over 40 deaths, has reaffirmed the need for ready access to such infectious disease control centers, even though in our time, nobody should die of the disease. Early reporting is what is required, and I implore everybody to heed this call. As the Christian celebration of Easter was severely affected by the virus, resulting in the cancellation of the usual activities associated with Easter, the holy month of Ramadan has not been spared either. It is my understanding that in the time of the Prophet Muhammad, sallallahu alayhi wasallam, any time there was heavy rain, he admonished the faithful through the azan to stay in their houses and pray rather than going to the mosques. In Bukhari's collection of the Hadith, Book 13, Hadith number 24, Ibn Sirin reports that Ibn Abbas said to his muezzin, and I quote, "After saying, 'I testify that Muhammad is Allah's messenger,' do not say, 'Come for the prayer,' but say, 'Pray in your houses.' It was done by one much better than I, that is, the Prophet." Through analogical deduction, Muslim scholars agree that rain represented danger, and therefore the prescription for Muslims to stay at home and pray in times of heavy rain is applicable to all life-threatening situations. I thus call on all Muslims to heed this prophetic admonishment, to pray at home, so we can protect ourselves from the danger of COVID-19. This is in line with the counsel of the wise, devout Muslim scholar, the chief imam, Sheikh Dr. Usman Nuhu Sharabutu. I wish all Muslims Ramadan Mubarak.
So the president spoke at length about all the measures that have been taken so far. So we'll speak to Dr. Paul Osodro. He's a known public health specialist and a consultant as well in that area. Now, good morning to you, Dr. Osodro. If you look at the president's speech, it follows the protocols. How does that, in a way, also sync with, you look at the incremental number of cases that had been recorded on the day, alongside the speech that he gave to reassure the ordinary Ghanaian in the first place? Dr. Drew, are you on the line? Dr. Drew? Well, we seem to have some difficulty trying to establish that line. We'll make sure we do that. Again, we'll go over to the speech and bring you, again, a part that also speaks volumes to the effort being made by government and the rest of the ministries, departments, and agencies that are working in tandem to make sure that coronavirus is well managed in our country.
We're going to beef up our existing laboratories and establish new ones across every region for testing. We will establish 3 infectious disease control centers for each of the zones of our country, that is the coastal, middle belt, and northern, with the overall objective of setting up a Ghana Center for Disease Control. The recent tragic CSM outbreak, with over 40 deaths, has reaffirmed the need for ready access to such infectious disease control centers, even though in our time, nobody should die of the disease. Early reporting is what is required, and I implore everybody to heed this call. Just as the Christian celebration of Easter was severely affected by the virus, resulting in the cancellation of the usual activities associated with Easter, the holy month of Ramadan has not been spared either. It is my understanding that in the time of the Prophet Muhammad, sallallahu alayhi wasallam, any time there was heavy rain, he admonished the faithful through the azan to stay in their houses and pray rather than going to the mosques. In Bukhari's collection of the Hadith, Book 13, Hadith number 24, Ibn Sirin reports that Ibn Abbas said to his muezzin, and I quote, "After saying, I testify that Muhammad is Allah's messenger, do not say, come for the prayer, but say, pray in your houses. It was done by one much better than I, that is, the Prophet." Through analogical deduction, Muslim scholars agree that rain represented danger, and therefore the prescription for Muslims to stay at home and pray in times of heavy rain is applicable to all life-threatening situations. I thus call on all Muslims to heed this prophetic admonishment, to pray at home, so we can protect ourselves from the danger of COVID-19. This is in line with the counsel of the wise, devout Muslim scholar, the chief imam, Sheikh Dr. Usman Nuhu Sharabutu. I wish all Muslims Ramadan Mubarak.
And Dr. Paul Osodro, the public health specialist and consultant, is back on stream. Good morning to you, Dr. Paul Osodro. Now, what do you make of the president's speech in relation to the guidelines that he's entreating all Ghanaians to follow, and then also how that has an impact generally till now on public health and management of cases in relation to how we've seen the incremental numbers at the time that he gave his speech? 1,550 in excess as we saw it.
All right. Good morning, Roland.
Morning. Please just go ahead.
Yes. Let me start from the case count. We have to be clear how we bundle the figures about. What we are seeing are not new infections. If you remember very well, during the president's last address, he said we still had a backlog of some samples to test. So the positive cases we are getting is as a result of the backlog testing we are doing. It has no relation with new infections. So we shouldn't be really worried about what we are seeing. I mean, it is expected. Once you test, you will see. So the more we test, the more likely we are to encounter higher numbers. Secondly, on the measures the president put out, as of now, we don't have any known treatment. We don't have vaccine for prevention. So what we basically do is preventive measures in order to halt the spread of the infection. We know majority of the infections occur through contact with infected persons. So any measure that aims at limiting as much as possible contact with persons is a step in the right direction. So I agree perfectly with the president with a 2 weeks extra extension on the ban of public gathering. I think last week also he made mention of we wearing masks mandatorily. We should be very careful with that, because the mask, as we all know, is a filtering device. It is just like the sieve or the strainers we use at home. If you are preparing palm nut soup, you use the domestic strainer, and that one is able to filter out the fibers or the chaff you have from the palm fruit. If you go to the market, those who sell doughs, corn doughs, cassava doughs, they also have a type of sieve which removes chaffs from the dough. But the holes, or what we technically call the pores in those sieves, are different. So depending on how you want your mixture to be, will inform the kind of sieve you use. What I mean is, with the face mask, they all have their filtering capacities. So for the ordinary cloth masks and the surgical masks, they may be able to filter out the large droplets and maybe medium-sized droplets. But we've come to realize that with this COVID-19 transmission, there is something we call short or close-range aerosol transmission. And that is very critical in the spread by asymptomatic patients, because we say for the COVID-19, majority of the transmission occurs when someone coughs or sneezes and releases droplets which may fall in your eyes, nose, or mouth. Asymptomatic transfer also occurs. When we say asymptomatic, it means those people are not coughing, they are not sneezing. So there may be means by which they are transferring. And that is through aerosol. Aerosol are produced when you speak, when you talk, when you exhale, in addition to the coughing and then the sneezing. These aerosols are very fine particles that may escape bigger pores or holes in some filters. So at this point, I believe the FDA must make it a point or take it upon themselves to ensure that the filters on the market have the right filtering capacity in order to be able to protect the public. Other than that, it will create a false sense of security, and we may, lower the guard on some of these preventive measures, and that may possibly cause a spike in the infection rate.
We know that this encouragement to wear masks, even though safe, is also following a release from the Ghana Health Service that was, and also with the Ministry of Health, that was issued just before the close of the weekend. Now, in the statement, it said directs, okay, the Minister of Health hereby directs. In the scheme of public safety, how does using words like direct become enforceable within the remit of ensuring that public health is achieved?
Direct is more of, as we speak now, there is no law which makes it legal for the wearing of mask. So what we see is more of an advice. An advice could be taken or not. If somebody fails to wear the mask, I don't know of any law which may lead to the prosecution of that person. So I believe, as a matter of urgency, maybe some amendment could be made to the Public Health Act 851/2012 of Ghana in order to ensure that it is mandatorily worn. Alternatively, I think what the supermarket and then other public places are doing is encouraged, because if you don't have the marks, you will not be admitted. So in the absence of a legal framework, this may help. But I believe for the greater good, if some enactment of a sort could be made to make it compulsory or give a legal backing to this advice, that may go a long way to help the public, rather than just an advice for people to wear. And also, it is important that if possible, government should make these things free as much as possible to some of the vulnerable and poor population. Because someone may say, I don't have money to buy the mask, that's why I'm not wearing. At that point, what can you do? Nothing. But if it is made available and the person fails to wear, then some form of punishment could be meted out to the person if we have a legal backing to that effect.
Now, it's been 7 days since we had the lockdown lifted. Arguably, there are movements to and fro, whether from the existing or the initial lockdown cities to other communities or cities across Ghana. For public health analysis or observation, what could be the effect, trickle-down effect on case management, spread, and related matters?
The truth of the matter is, we don't have facilities across the country. And I think the president alluded to it during his address yesterday, that
Please go on, Dr. Osodro.
Okay, I think the line dropped, sorry. So the president alluded to the fact that we don't have equal distribution of health facilities across the country. So it will become very burdensome in some areas if we have a spike in the cases of COVID-19 in those areas. The best advice is, now that the restrictions have been lifted, you cannot prevent people from moving. So as much as possible, I believe these thermometer guns should be deployed in all public places where temperatures of persons moving in and out of those places will be taken at random. And we have to do it very fast, because with the onset of the raining, with the onset of the rains, malaria is likely to kickstart. And malaria also presents with high temperatures. So if we don't do it very fast and the malaria kicks in, it may affect some of these things. Secondly, testing in this instance is very key, as has been championed by WHO. The CDC of US released quite a frightening statistics, I think, last week. The US is likely to hit its 1 million mark today. What the report said, that the number of persons infected, about 25% of them were asymptomatic as at the time they were detected. And out of the 25%, 18% of them will go on to recover without showing any signs or symptoms, meaning those people will not even know they have contracted the infection. So if you look at the US statistics, for example, it means 250,000 are asymptomatic, and out of that, about 45,000 will not show any signs or symptoms. And looking at how fast this disease spread, if you have this large pool of asymptomatic persons in the community, there is no way we are going to be able to win the fight against this. So I will expect that we also increase the number of testing facilities available. We should get to a point where testing will be made accessible to every person who presents with the slightest sign or symptom. And then we also go into the high-risk communities and then test as many as possible so that we can move these asymptomatic persons out of the society. I remember during our last week interaction, I also made a call for frontline workers to be tested, because they may present a very high risk and may start a second wave of epidemic if we are not careful. I saw the Ashanti Regional Health Director lay out some plans to test high-risk persons, like commercial bus drivers, market women, and then frontline workers. That is the way to go, because these persons come into contact with a lot of people who may be asymptomatic, and for which reason they may contract the infection. So once we go into the community and target these high groups, and then we test, those who are asymptomatic will be picked out of the community, and then we'll be able to at least have a hold on the infection. But as we speak now, we'll still be recording cases. The pandemic is far from over. It will be with us for some time now. Without vaccine or appropriate treatment, we just have to make sure we stick to the precautionary measures and then try to manage the cases that come along the way.
We've also been joined on stream by Dr. Colonel Festus Abuaje, retired. Sorry, I was adding more accolades to your initials. He is a security analyst and a consultant. And good morning to you, Colonel Abuaje.
Good morning, Roland.
Well, I called you doctor. I'll take it off. So now
never mind.
We
I don't deserve that.
we stick with the Colonel. But there's again a reiteration of that caution, saying that everybody should wear face masks. And I was just thinking about it. Even though there's a statement formally from the Ghana Health Service, it says in the wording directs. Within the realm or scheme of security, the structure of security architecture, how enforceable is that?
Well, I think if it comes to the wearing of masks, it's obvious that you can easily identify who is wearing one and who is not wearing one. It's not like the previous situation where you needed to ascertain the veracity of what the individual was telling you, that I'm going to work or I'm going to buy food. So it's a very clear-cut question. If all Ghanaians accept what the president said, which is for our good, they must put on the mask. If we're not wearing the mask, the question then becomes, what do we do with the individual? What should the security forces do with that individual? Let me leave the legalities aside, whether there is a law backing what the president has said or not. But there will be a number of courses of action available to the security personnel. One is, depending on the locality, you can send the person back home. But back home, if it's 3 kilometers away, it's not going to be as simple as it might sound. You can't detain the person, i.e., temporarily restrict the movement, and maybe, as we've seen in the media, keep them waiting for until you are satisfied before you allow them to go home. But it will be easier for the security forces to expect and demand of every citizen to wear the mask. I'm not too sure whether they can detain persons in their numbers if they are not wearing the mask. And in the absence of a law, as being suggested, whether they can use that to prosecute. So it's a question of the numbers of persons that the security forces might come across who are not wearing the face mask.
Now, knowing that it's been 7 days since we lifted the lockdown, and knowing that definitely there will be movement of people, what have you heard? What have you observed? What, in your own capacity, is your concern about, from the last time we spoke, the enforcement of movement in relation to how that could keep restrictions or improve the current situation of people applying to what the general guidelines or rules are?
Yes. Sincerely, I haven't been out much. I think I said last week that I only went to Kuntunse DVLA to renew my roadworthiness, then to Providence Circle to renew my insurance, and then came home. I've not been out much, but from what I'm seeing on the radio, in the media, the challenge still remains the nature of our society, i.e., where we live, the conditions under which we live, and then the markets, largely the markets, how we go about, pursuing our livelihoods by way of trade and buying and selling at the markets. So, mask aside, social distancing becomes quite an issue. Yesterday, I think we had the president comment, is it one of the markets in Secondary Takwa? They have forgotten the name. I haven't seen that footage, but it's going to be very difficult, a bit difficult, for market women to socially distance. And then for the persons who are going to buy to also socially distance. So I had occasion to suggest that rather than leave the market open for everybody to enter, we could regulate or control the number of persons who enter market areas to buy. If we can let people enter the market in numbers with some forms of escorts, that security forces escorts, and bring them out and let other persons go in, probably that might be helpful. I've also suggested a curfew, that the fact that we're supposed to trade doesn't mean that markets must open from 6 a.m. to 6 p.m., for instance. So we could impose some curfews. The whole idea is not to restrict the livelihoods, but to try and minimize the degree of contact among different segments, of the society. So I want to believe that the security forces have been going about their duties. They should still be on the roads by way of very limited roadblocks and checkpoints, but patrolling, looking around for persons who are not socially distancing, and then for others who may not be wearing the face mask, or for those who are gathering whether for religious or for social activities. How well they are being able to do that, I think I cannot personally speak to that because I have not been about town.
Well, because I just want to wrap up. Now, we know that we've had an extension of the restrictions, additional 2 more weeks. In that, the president sort of sought to, whether to admonish unpatriotic Ghanaians who, so to speak, aid so-called aliens or foreigners to make entry. Now, the question is, the restrictions, extension, good? Now, is it that we have all along had Ghanaians who apparently are the reasons why we have foreigners making entry to the illegal borders, etc.? But while we know all along it should be the work of the forces, immigration, etc. at these border points?
Yeah. Well, it will be very strange, and I'm not speaking about the president, but it will be very strange for any one of us to expect that all of a sudden, all of us in Ghana have become law-abiding. That will be a very long shot. So the fact remains that at all times, since we have been together as Ghanaians and even before, there have been persons who have made it their livelihoods to, flout regulations, whether by smuggling or some other antisocial criminal activities. So the Galamsey, I believe, is still going on. Cross-border smuggling will still be going on. And the president was right by saying that I think somewhere in the OT or other regions to the east, there was this case of a group of people or persons who were intercepted. Now, what worries me is that from a military perspective or security force perspective, discipline is not something that you expect even security personnel to comply with. So we have self-discipline and we have enforced discipline. And the rationale or the philosophy of the enforced discipline is that, look, being human beings, if you tell a soldier not to go to point A, the very reason that you say don't go to point A, that soldier will go there. So that's what we've been saying in the media, that for the mere fact that you say Ghanaians must stay at home, some Ghanaians want to come out to see whether indeed everybody is staying at home. So it might be a field day for those who are engaged in some of these, criminal activities, ferrying people in and out of the country, for a number of reasons, but ultimately for some means of livelihood. So it stands to reason that we need to tighten the border security, and that wouldn't mean that every inch of our borders will have to be, manned by security personnel. But we need to increase the capacities that they have, the numbers that we have deployed, the gadgets that, we have equipped them with, and then the methods that they use. For instance, if you cannot man your borders 100%, you can have certain strategic or tactical checkpoints along certain routes. So even if you don't intercept at the borders, you can intercept within certain distances into the country.
Okay.
It's going to be a tough call, and I believe that the security forces, are doing the best that they can. Again, as always, some of these persons are well known to the security forces, i.e. the immigration officers. So, again, bribery might be part of the equation, that somebody induces a security or immigration officer to allow him or her to enter with a certain number of persons. We can't rule that out. So that becomes an internal policing matter for the immigration services. By and large, all of us are citizens. And as I said also, ensuring some of these measures requires, in fact, all of them, requires the cooperation and collaboration collectively of the communities, of the assembly men and women, and of the different levels of authorities at the district and then at the regional level, all of us as Ghanaians must become part of the effort in enforcing or practicing the guidelines that have been outlined by the president.
All right, thank you very much. Dr. Colonel Festus Abuaji, retired, is a security analyst and a consultant, and he's been helping us. And Dr. Paul Odro is also a public health specialist and a consultant as well, teaches his field, and so also helping us with all the analysis, talking about the president's speech. But before I let you go, Dr. Paul Odro, in 2 minutes, tell me, we have these restrictions going to go on for the next 2 weeks. In 2 minutes, tell me, that's the way we have to go, and for how long do you think we need to keep having these extensions?
Okay, so it will be important at this point to know our daily infection rates. And we can only tell if we are doing well if we begin to see a decline of the daily infection rate. As we speak now, samples are taken over a period and then they are run. So results are released, and that may cover samples that have been taken for about a week. So with this, you wouldn't be able to know what you are recording on a daily basis for you to know whether the measures you've put in place are working or not. So until these backlogs are cleared, and then possibly we expand some of these testing centers to other places in order for us to have results in real time, it may be very difficult to tell how we are doing as far as managing our daily infections rate are concerned.
Okay, thank you very much. And Dr. Paul Osodro, a public health specialist and a consultant, and we'll take a look at other related issues. And this